All these things are happening by design. And you rightfully said that the governor had a long-term vision for Kisumu, to make Kisumu a medical city, but also a medical technology city, which means we need all the advances here in this city, but also taking care of the lowest people in their villages. We have 3 more propositions for pharmaceuticals who want to set up here, and we will see how those go by. It takes years between the time you make a conception to the time you start manufacturing. So 2 of the companies are already ahead.
Sickle cell has been a passionate program for Unigen, and that was our first product inception. Why Kisumu? Kisumu is the epicenter, I would say. Kisumu carries the highest burden of sickle cell disease in the country, whereby we are looking at almost 25% carrier rate to up to 2 to 3% disease. So, and Kisumu being again chosen as will be the center of sickle cell management. Our program for hydroxyurea, the drug that is standard for treatment of sickle cell, will be of value here. But in pharma is not just a one-time product. The lines we create can manufacture way more drugs. So having a facility that is FDA equivalent, we can manufacture way much more medications. We've been in discussion with the Ministry of Health. We now know Africa is not just infectious disease, but we're seeing a lot of NCDs, diseases like diabetes, hypertension, and cancers on the rise. And the same production lines that we'll create here will be able to handle those drugs as well. One thing that is our big focus is IV fluids. And it's not just IV fluids, but also parenteral medications, IV antibiotics, IV cancer drugs, eye drops, ear drops, any medication that is in the IV form. Kenya imports up to 99% of drugs that are in IV formulation, 80+% of IV fluids. So this is what we want to turn around, because it's not just having fluids, but we have to have a health security. COVID-19 was a wake-up call. We want that we have a healthcare security by having products that will support in case we have another pandemic.
Actually bringing this technology and teaching the children and adults here in Great Lake University, we are actually leapfrogging Kenya by about 25 years. Because these are not just products that we are trying to teach, things that are going in evolution. This has been tested and used in different parts of the world like India, US, and other parts of the world. So this gives us a first mover advantage for Kenya and Kenyan children and employability in the near future, at least for the next 10 to 15 years.
We are really excited about this project. It's urgent and needed.